Hello, dear people. This is Dr. Sari Avraham, and today we're going to continue with the second part of dental medicine. Up until now, we've talked about complementary dental medicine, all the things you can do to improve your health, and by doing so, also strengthen your gums, your teeth, and everything that's happening in your mouth. We talked about the way we breathe and how it affects our teeth. We talked about nutrition habits. We talked about sleep habits. We discussed all sorts of things you might be doing that can harm your teeth and how to avoid them. And basically, we brought to your awareness a whole lot of things that affect your teeth themselves. Now we're actually going a bit deeper into the whole topic of dental treatments. And there are a lot of mistakes that cause you to keep suffering from your teeth, even from the side of thank you the way the treatments are performed. And what we really want to do is give you information that is extremely important, which will allow you to undergo dental treatments in a much, much better way. And here, we're actually going to start with the most basic part, which most people simply aren't aware of and don't do properly. And this thing is actually the first thing is, and that's why so many people only come in for dental treatments when it really hurts. That's actually most people. And they don't realize that a lot of things can happen inside our mouths long before it starts to hurt. Because pain is usually just the tip of the iceberg, really the very end of the process. But before the pain started, a lot of other things happened inside the mouth that led to this situation. So, actually, my first tip for you here is to come in for regular checkups at the dental clinic, and then you'll be able to take care of things in time long before they develop into something much bigger. Now, here, I'm actually speaking to our health conscious audience, whom we see a lot, a lot, a lot. There are all kinds of practitioners and approaches that will tell you that you should see the dentist as little as possible, unfortunately. This is an approach that leads people to come to us at a very, very, very late stage. And then their treatments are very extensive, very complex, and very expensive. If there's one piece of advice I can give you that will help you save a lot of money on dental treatments, it's simply to come in for regular checkups on time. It's really just like how we maintain a car, okay? We're putting a huge amount of mileage on our teeth here. Just think about how much we use them all the time, and it's just not reasonable. It's not likely that a car would go on the road without passing an inspection every year. So the bare minimum for you is to go for your checkup. Now, it's actually against the interest of any dentist to check you regularly because supposedly their interest would be to see you only when you already need a lot of treatments. So, if anyone thinks that it's in the dental profession's interest to give you regular checkups every year, I think that's a very, very serious mistake on this subject. Because the main interest, or your interest, is that you want to go to the dental clinics so they can check you and make sure that big problems aren't developing, which would then become much more expensive. And your best friend in this area is actually the dental hygienist. Now, when you go to the dental hygienist, it's not enough to just have a clinical checkup. In many clinics, there's more to it. The ability to combine a cleaning with a hygienist, and at the same time, she can also, every few months, depending on how often you visit her, take x rays, send them to the dentist, write a few notes about what she saw in your mouth, and if everything looks fine, they'll tell you that you can continue. You have the green light. But if it looks like there are things developing beyond that, then basically they'll recommend that you come in for an examination by the dentist. This is also an option that quite a few people prefer because then it also saves them from having to come to the same clinic twice. It really depends on whether it's a public or private clinic. And in public clinics, what I just described is less common. Now, another mistake, especially when it comes to pain, is actually coming in when the pain is really, really severe. People try to hold out, take painkillers, do whatever you do at home, and then you end up coming in when it's already really bad. You've reached the absolute limit. So that's also a mistake you should really try to avoid because we actually want to treat things before it hurts. The real wisdom is to treat a calm mouth because when there's pain, it means there's some kind of signal in our nervous system alerting our immune system that there's a problem here. This causes the immune system to send out its soldiers and create an inflammatory process. When we're in the middle of this battlefield, basically any procedure we do will trigger side effects. Thank you. That's why many times we recommend that people first reduce the pain and come in when the immune system isn't in attack mode. So, how do we do that? First of all, we make sure to maintain really, really, really good hygiene. That's the most important foundation. And I recommend you check out the episode I made for you about how to take care of your teeth and how to clean them at home in the most effective way. And if you have a lot of problems in your mouth, then that's the episode you want to start with. Because if you come in with pain, with inflamed gums, with a lot of plaque in your mouth, with a lot of problems, what will happen is that the diagnosis won't be very accurate either. In the episode about root canal treatments, I'll explain how many times there's a misdiagnosis when it comes to tooth pain, and a lot of people experience toothaches that actually don't come from the root at all, but rather from the gums. Other sources as well. And so, if you come more prepared, if you get yourself ready for dental treatments and for your visit to the dentist, then the diagnosis will be more accurate. So basically, what you want to do is prepare yourself for the diagnosis at the clinic. And also for the diagnosis at the clinic, afterwards, the doctor will also give you various tools, if the doctor, of course, uses the approaches we're talking about, that will allow you to significantly reduce the inflammation present. Because, first of all, we want to put out the fire, and only then will we talk about how we can treat it in the best possible way. Because really, our goal, and I assume it's your goal too, is to avoid invasive treatments as much as possible. Because the more we keep the teeth and gums in a state that's as close to natural as possible, we know that our success and our ability to maintain these teeth and the success of the treatment will be higher. And quite a few studies indicate that, in fact, the more we preserve our natural teeth, the longer we will actually extend our lives. To make a very distant comparison, when we know that when horse traders want to buy a new horse, what's the first thing they'll check? They'll check its teeth because that's how they know the horse's age. Now, this example might sound a bit funny, but actually, people who want to live longer need to take better care of their teeth. And I'm not just saying this. Our teeth are a very, very important foundation for quality of life and longevity because actually, our teeth have, do you get it? Throughout this course, you'll see that they have so many roles for us in life. The more we can keep them in a state that's as close to natural as possible, the longer we'll be able to maintain them over the years. And this is where the treatment I already gave you in previous episodes comes in. It's basically the fast track to putting out those fires in your mouth. If you come in with a lot of inflammation and problems in your mouth, what we'll often recommend is to use special trays that are soft and comfortable, and anyone can use them. Inside, we'll put various substances that, first of all, will reduce the inflammatory response, neutralize bacterial activity, and strengthen the area. Because, first of all, we want to do things that strengthen and soothe. And once we're working on a clean foundation with no bacterial activity, we can move forward, and the results of our treatment will be much better. What most people do actually is that they don't treat things until they reach a point of pain, and then they want to be treated immediately, right now. And actually, in situations like these, when we come unprepared for treatment, the consequences of the treatment will always lean toward a more invasive approach. So, if that's something you want to avoid, on one hand, there will be people watching this video who are interested in avoiding treatment that's as invasive as possible, and there will be people who are mainly interested in saving as much money as possible. Of course, the more the treatment is. Every second or more advanced treatment requires more steps along the way, okay? The moment we do a filling, then it's just a filling. Or if it's a pulp capping, then it's a filling and a pulp capping. But once we need to do a root canal, usually that comes with a post and a crown, and then it's already multiple steps. There's a lab involved, and the costs are significantly higher. So, here, for anyone who really cares about saving money or avoiding treatments every few years, you basically need to come as prepared as possible. Let's talk about the treatment itself. And what you should do, first of all, is start brushing your teeth and your gums. Another thing, which I'll talk about in the next video, is why for so many people, fillings fall out and cavities actually form underneath their existing fillings, and how you can prevent that. We'll continue in the next video. It was a pleasure being here with you today. always here for you, Dr. Sarit Avraham, and the wonderful team of experts at the Dental Clinic in Jerusalem.